When we talk about the chronic venous disease, of course, we take into consideration some aspects. Firstly, the genetic influence of some genes and the alteration of the gene may be involved in the predisposing factors like inflammatory cytokines, proteases, and so on. But in conjunction with the hormonal influence of a specific microenvironment, of course, there is an important role of the extracellular matrix imbalance. And the imbalance may be, of course, guided by TGF-beta, the matrix metalloproteinases, and several other proteases that may be able, through the endothelial growth factors, to modify the endothelial profile and behavior. Lastly, conducing the effects in the dysfunction of endothelial cells and the alteration of vein wall. Of course, there is several steps for the progression and evolution of the chronic venous disease, from the evaluation of risk factors and the hemodynamic and mechanoreceptors mechanisms. This is important because the hemodynamics alteration may be involved in, firstly, in hypertension of the venous and the stretch and relaxation of the vessel wall. All these mechanisms may be able to prone the vein to an altered mechanism through the mechanotransduction of signal of the hypertension, inducing through different pathways the expression of several molecules, biocompound like the hypoxia-inducing factors, the selectins and the adhesion molecules, several proteases like matrix metalloproteinases, and so on. All these proteins and growth factors are able to induce, of course, several effects in target cells like endothelial cells, polymorphonuclear cells, but also the extracellular matrix, inducing, of course, as finally aspects, in the altered function of three main aspects presence in chronic venous disease: the vein hypoxia, the inflammation, and the focus of these lectures is the attention to the inflammatory pathways inside the chronic venous disease, and the remodeling effect to restore some function of the vessel wall. Of course, there is an important aspect is the evolution and progression of the disease. The CEAP classification from C0 to C6 is able to identify different steps of evolution of this disease, and the change in inflammatory pathways, in alteration of cells and tissue modification, may be able to sustain the inflammatory condition of the microenvironment in the endothelial cells, leading to skin changes and, of course, to tissue breakdown, and also the venous ulcers appearance that may be importantly sustained by several biochemical aspects.